like this. Do we offer ear enlargement at our clinic? Exploring options for ear enlargement stroke reshaping, as my ears are smaller than I feel would be proportionate to my face. I'd like to inquire about the specific techniques you offer for resizing small ears and whether you can customize the procedure to enhance both the size and shape of my ears. It's unusual to have a small ear issue, or at least as an adult, it's unusual to have a small ear issue. Small ears are a thing that can happen congenitally. Babies can be born with small ears, and it is called microtia, which is small ear, microtia, and it is a specific branch of plastic surgery involved in reconstructing those ears, which is often quite extensive, often quite staged. So several procedures are needed, and it's as I say, there's only a handful of plastic surgeons who will actually perform ear reconstruction for congenitally small ears. So I'm feeling this is not a microtia. I'll feel it close on TikTok. I feel that this is not a microtia question. I feel this is someone who feels that their ears, well, they've said their ears are small. So reshaping ears, we certainly do. And the flip side is normally true, actually. People think that their ears are big and want them reduced, and we don't actually reduce or enlarge ears. What we do is we reshape ears, which means that we make the reshape the cartilage. So bring the cartilage back and recreate. Often either there's two common problems you get with people who have prominent ears. One is the loss of the antihelical fold, which is this fold here. This is a helical fold, the outer one, and the antihelical fold is the inner one in the aspect of the ear. So one is the loss of that. So if that's lost and the ear is out like this, then we can recreate it by folding it back. And the other is the deep scapha. This is a scaphoid bowl. This bit in here, this is called the scapha, so a reduction of the scapha. So you can take a wedge and reduce the scaphoid bowl, and or recreate the antihelical fold. So it might be one or other, or a combination of the two. And that's basically to reshape an ear. So as I say, commonly people think they're big, but they're often not big. Often it's just that the shape isn't right, and if they're prominent, so we reshape them back. So if you were going to make an ear a different size, it would potentially be easier to make it smaller rather than larger, and that would we do sometimes do wedge excisions of the ear to take a wedge out of the ear, but that's for a skin cancer. So if you have a skin cancer on the ear, you can take a wedge, so like a slice of cake, out of the ear and then close it down, and actually it looks really good, because you often can do it on one side and not the other, and it looks really good, and you often can't particularly tell. So it's possible to actually make an ear smaller, but the only time it is kind of commonly done is if you've got a skin cancer, to take a wedge out, and certainly making an ear bigger is not. So the question is how. What are our specific techniques we offer to resize small ears? We haven't got any techniques to resize small ears, so we do not offer ear enlargement. If you do feel that is the issue, that the ear is too small, then an ear specialist would be the way to go. David Galt is traditionally the one that people turn to. Somewhere East Grinstead or somewhere, I think, not quite, or Mount Vernon. I'm not sure where he is, but he's somewhere kind of the London area. I'm not sure if he's might be sort of retirement. I'm not sure. In Birmingham, there's Mark Lloyd, but again, I don't know. He might have retired as well, but he's doing a lot of property stuff. So Mark Lloyd is, and there's a few dotted about the country ear plastic surgeons. So we've all got subspecialty interests, but there are more common subspecialty interests like burns and hands and craniofacial and breast. Those are the sort of common ones. Ear is not a common one, but there are a few ear specialists in the country, and they would deal with microtia, small ears. But as I say, it's usually a congenitally small ear that we're talking about, rather than just making a kind of normal, if you like, a normal ear, enlarging that. That's actually not something that we offer, and not something I'm familiar with anyone offering really. But you would best place to talk to a ear reconstructive surgeon.